Rainforest is a dental diagnosis 3D imaging software that loads CT images based on DICOM format. It is engineered by Precision and experience of the experts in the field, and this video is going to show you how CBCT is read in Rainforest. So when the software opens, you will have a region set default in NPR. You can select a specific view from the View tab, NPR, Panorama, or Implant. And you can also customize the layout by Change Layout. Your most favorite layouts will be automatically saved, and you can make any of the image primary by clicking in the top right of each window. This region will be the rendering window, where your patient's images are displayed. Rendering window breaks into 4 windows: coronal on the top left window, sagittal on the top right window, axial on the bottom left window, and 3D image on the bottom right window. Each image contains patient's information, information of rendering mode, information of length, and scanning information. Axis shows the location of each window, so if you move any of the axes, the other axis will move along with it. And if you place your mouse out from the intersection, you will be able to rotate the axis. We have a main toolbar located on the top region, and a view control located in the left region. The view control allows you to manipulate or to have control over the patient's images with each view tab. Now let's take a look at the main toolbar. Main toolbar contains tools which can be accessed to perform certain functions on patient's images. You can reset, open, and save file, and easily capture the area of interest and do print. This blue area allows you to do free draws, such as arrow, circle, polygon. Oh, by the way, all the functions will start with the left click on your mouse and will finish with the right click. So let me finish it with the right click. And you can draw free lines and also leave a memo on the spot. We have distance measurements, angle measurements, and a Hounsfield scale, the bone density measurement. If you want to measure the density in a certain area, you can either draw a line, point A to point B, or choose a specific area. We have the case information, view information, version information, and setting. On setting, you can adjust the default setting for clinic information, language, view, cross-slice, and DICOM. Now in view control on the left, pan allows you to shift the image into any direction by using both left and right buttons on your mouse. You can zoom in by dragging your mouse with the middle mouse held. And in case if you're not positioned in your desired area, then use pan again to shift the image. You can also use magnification to magnify the areas. And you can have your axis off and back on. And you can also create a cube on 3D image. You can adjust the brightness, invert the color of 2D image, and apply sharpen filter, which is one of our core functions of Rainforest. And you're able to modify the brightness, contrast, and sharpen filter with a slide bar. You can have the 3D image to be shown or not to be shown, and this function can be very useful to use with the ion. The ion converts the prosthetic appliance into STL format. So after you apply the ion, if you remove the 3D image, you can get a clear look at the prosthetic appliance by itself. You are able to select an aspect of the 3D image: right, left, front, back, top, and bottom. You can adjust the opacity and define TF setting, the transfer function, also known as fine-tuning. TF setting is set default with several different settings, so it can be applied quickly. We have default, teeth, grayscale, inverse, soft tissues, and bone. You can measure the length and the angle of the 3D image and also set segmentation of the 3D image. Now on 3D clipping, you are able to clip the 3D image based on selected axis. And the flip clipping, suppose, inverts the clip based on relevant axis. You are also able to bring a 2D image to the cutter surface of the 3D image. Now let's take a look at Panorama, the Arch Section View tab. Panorama is set default with an auto curve displayed on the image, but you're able to edit or modify the curve with the picking points, the orange dots. And the very best thing about this view tab is that it allows you to view the image using multiple cross sections. You can set your range in Panorama window and adjust the brightness, contrast, or apply sharpen filter. You are also able to adjust the width, interval, and the thickness of the curve for your preference. So before we start tracing the nerve pathway, let's take a look at the panorama rendering window. The green line shows the location of the cross-section along the arch spline. The red line shows the axial range of the arch spline. And the yellow line is the center of the arch spline. Now choose the best layout or the window which is easy for you to use and start tracing the nerve pathway. Now click on the nerve and start with a left click on your mouse along the nerve pathway. So when you're finished, right click on your mouse. Now go to NPR to see if the nerve pathway is situated correctly in 3D reconstruction window. You can adjust the opacity to see it more clear. Good. Now let's move on to implant. This view tab allows you to see implant planning module from any angle and helps your implant to be placed properly. Click on Add Implant and select a fixture and place the implant in the desired position with a double click. If your implant is placed too close to the nerve or on the nerve, it gives you a warning to avoid the nerve tracing. The mid window is a view from the top, and the right window is view from the side. Bottom right window displays a real-time visualization of the volume density surrounding the implant and gives you the result of the implant. Rainforest has developed a comprehensive solution for implant planning and to optimize your treatment planning. So if you're interested or want to try a trial version to practice, please do not hesitate to contact us. Contact information is below the video.